we have a panel of patients and caregivers who have graciously agreed to share some of their insights, provide maybe a little advice for those of you who are at different parts in the process, understanding the diagnosis. So we're going to take about the next, probably 20 minutes or so, and have the opportunity for all of our panelists to share. So I'm going to ask each of you very quickly to identify yourself. So name, how long you've been diagnosed, your tumor site if you're happy sharing that, and obviously patient or caregiver. So.
Hello, I'm Janet Medhan. I'm a patient, and I was diagnosed in 2011 with inoperable tumors in my liver. I'm a mid-gut carcinoid patient that metastasized throughout the liver. And I go to Northwestern.
Hi, I'm Sherry Gilly. My son, Sean, was diagnosed in 2011 at age 21. Never found primary tumors, but severe syndrome. And I'm here as a caregiver.
Jan Rutazzi, and I am a patient. I was diagnosed 2 years ago this month, and I had a primary on the ileum and metastases to the liver.
Hi, Kim Canman. I'm a caregiver for my mother. She was diagnosed in 2004, primary gut and metastases.
I'm Mary Zeller. I'm a patient. I was diagnosed in, Mary Zeller. I'm a patient. I was diagnosed in 2007 with an ileal primary and metastases to the liver.
All right, so a good place to start, and I think it's appropriate for what we're doing here today, trying to provide education. It's certainly a challenge for any cancer patient, I think more so for patients who have rare cancers, to educate yourself about your diagnosis and find good sources of information. So I'd like to hear from each of you, whether it's your personal experience or your family experience as a caregiver. What were some of the avenues for education that you found were helpful to you when you encountered or had the diagnosis? What was very helpful, and frankly, what wasn't so helpful? Mary, do you want to start down on that end, and we'll work our way up?
I can. Some of you know me and know that I'm kind of an information junkie, and I'm also the support group leader in Indianapolis and have been for 10 years. So I've been to many conferences, and I've had significant education as a patient in this disease for a long time. However, when I was first diagnosed, that wasn't necessarily the case, in that I was otherwise very healthy and felt well, and was very surprised by this diagnosis, and was pretty much flat out for the first few months. Luckily, I landed at that time at a cancer center in Indianapolis with a very experienced physician whose initial appointment with me was 3 hours long. You know, some of that was appointment time, and some of it was his, ordering things and doing different things. And so I was literally at that clinic for a little over 3 hours with my husband. So not all patients experience that. I feel very lucky that I had that experience right off, because I've certainly talked to many patients where that's not the case initially. So, but I wasn't pursuing a lot on my own necessarily beyond that, and it wasn't until about 6 months later, after a large surgery, and I really started looking into this disease and talking to other patients, and that's when and so I did it through conferences. There wasn't much 10 years ago. I wasn't a lot on the internet, but some, but mostly I sought out and attended patient conferences, and that was probably my biggest education then, and it's expanded from there. So.
Okay, much like Mary as well, when my mom was diagnosed back in 2004, there really wasn't much information out there, especially on the internet, and very few experts. And if there were, they were long distance. I mean, they were traveling adventures. So what I did at the beginning as a caregiver is I involved myself heavily in medical conferences up front with the initial physicians that treated my mother. They were very open to that back at the time. I actually went to CME events and things that were kind of non-traditional, because for a patient, there wasn't a whole lot of user-friendly information out there. So actually I educated myself through a lot of CME and physician-level education initially. And then, of course, as time has evolved, there's so much information out on the internet, which is great, but you also have to be cautious about that, because you can very easily fall into traps of false information and stories. So, but the long and short is, that's how I started, because of the time in which she was diagnosed. There was very little out there. So I had a lot of medical conference training initially, and then from there I still go to conferences today, and I think the biggest thing is peer support. So I've spoken many times to Mary, and then also to like NCAN group leaders and stuff, like Mary Ann Wayman's a big voice too. So just reaching out to other peers, I think, is really the best way, and through support groups continues to me to still be the best way to keep educated. And if you're newly diagnosed, I'd suggest that'd be your first way. So that's kind of my journey.
Well, I started out, first of all, with the internet, and there's a lot of information out there. There are Facebook pages and there are blogs, but I think you should be aware of publications that are available too. There's Zebra Talk. A good one, if you're just diagnosed, is the ISI book, and I just got a new primary physician, and she said, "Oh, you're my first zebra," and I said, "I'm giving you a book." She was very thankful, thank goodness. I like the conferences, and I'm a video freak. So I guess that's all. Oh, I know one I need to mention. Janet down here has been my mentor, great mentor. So she read through my Caring Bridge and went, "Oh, Jan, let me correct you on these things." So she's been a great mentor.
I'm sure many of you have had the same experience as my son. We spent 4 years without a diagnosis, and during those 4 years, and we circled back around to carcinoid multiple times. He'd go to somebody, "Oh, it's got to be carcinoid," and then they'd do some tests and say, "Oh, maybe not," and then they'd circle to something else. During that time, I thought one of my best things that I did was I always had a notebook in my hand when we talked to a doctor, and I always wrote down things as they were telling us, "Why do you think it's this? Why do you not think it's this? What?" So a lot of my information, my original quest for information really started with discussions with the doctors about what was going on, why did they think this, why did they not think this, and I always found that if I didn't write it down while I was in the office with them, I'd go home and forget half of it. Lots of words are thrown around, and then we did a lot of internet searching as well, I guess, at some point. But I think that our biggest help has been our support group. Not only because we get to see other people that have the same disease, but also we learn so much from each other. And I know a lot of us are in the room today, and a lot of us are up here on this panel, and it's been really a lifeline, I think.
Very much.
I would have to echo so much of what's been said already, but when I was first diagnosed, and my markers were high, and they were looking into everything and sending me for scans and saw an endocrinologist, I expected I would have 2-3 tumors that maybe we can go in and take out and monitor. Ended up that the tumor was too involved, and the recommendation was no surgery at this point for me. So then that was a local oncologist, and she said that she wasn't going to be able to do my management of my care because she didn't feel she was most qualified to do so, that I needed to be in the university setting. And that was a godsend for me. I ended up first going to University of Chicago, where I met Dr. Polite. Before that, in between, waiting for the appointment, I did all the usual internet searches and If I believed everything I read, I wouldn't have been here today, because I'm 7 years into this, and it was having me, a large potential of not being here 5 years from my diagnosis, and I'm doing quite well. So when I did finally get to the carcinoid specialist, at that point, I finally got some handouts and some vital information about how to live with this, how to handle it, and where to go for questions and research. I learned a lot from that first visit with Dr. Polite at University of Chicago. And then what you have to do along the way is just, I know everybody's got family, friends, coworkers, everybody there for support. But I'm telling you, I didn't really get educated until I joined the Wellness House in Hinsdale, and I got to talk to people that walk the walk. I like to say walk the walk, because that's exactly what I needed. Somebody who can tell me what my day-to-day is going to be like, what kind of treatment options are out there, what clinical trials. There was just so much to research, and I learned so much in my first session there that I've been going back every month ever since. So that was huge educational stride there, and also attending the conferences. I've been to several of the patient net conferences. So, just do your due diligence, find out everything you can find, and by finally getting educated, it calmed my nerves. I didn't feel as if they talked me off of the ledge. I'm going to be here a long time, and I'm enjoying learning all I can about NET and seeing all the improvements that have happened since 2011 when I was first diagnosed.
Good, thank you. So one of the questions that we get a lot is, how does a patient find the right physician? And we also get a lot of questions about how can you improve the physician-patient communications? How can you make sure that you're having that open communication that's so important, and getting what you feel you need as patients and caregivers? So what comments do our panelists have about that? Any thoughts from your own experience? Janet?
I go in with questions. I bombard him with questions. I just have a list on my phone that I will write down questions.
I think that's important, and I, in my previous life, I was a hospital social worker for a while, and worked in a few medical settings. And I think, especially in this disease, because for the most part, in most cases, it's indolent disease, your relationship with your physician and your medical team is going to last years. It's an extraordinarily important relationship, not just in terms of the medical care that's going to be advised that you pursue, but also that there's a trusting relationship and an honest relationship. So you feel comfortable enough to bring up to your physician and your team what actually is going on, because there's a lot of, especially if there's hormonal involvement in your situation, there's a lot of things that happen, and quality of life issues that you might be experiencing that you don't think necessarily is related to your disease or the medical appointment, but there might be interventions and supportive services like nutritional services or other things that could greatly improve how you manage your symptoms. And you can't get to that point unless you have a nice or a good working relationship with your team and you're partnering with your medical team. And I say partner, and I really mean that. I really think that both sides need to be very active with each other in trying to develop that relationship. And as a patient, I think it's very important to remember doctors are people too. And some have good days and they have bad days. And that you have to be understanding as well. I talked about my very long initial appointment. I'm sure that set him back that day, and I'm sure there were people in the waiting room who were not happy because their appointments were later. So I really try to be understanding of that situation. And so there's all kinds of things as a patient we can do to help that relationship and be understanding of your physician. So it's kind of a long answer, but I really think that back and forth and working to establish a relationship and to be honest with your physician about truly how you're feeling, whether or not you're sure if it's in relation to your disease, because that's the only way that you're gonna get to your optimum level of functioning, I think.
Yeah, I agree with Mary's comment. That was a very nice, well-rounded response, because it is like multidisciplinary. One other thing, too, to add to that is just candidness. You know, it's difficult sometimes as a patient, or in my case, a caregiver, to be candid, because you want to try and maintain a certain level of respect and trust, of course, with your medical care team, which is very important, but at some points, there is a call to just be candid, and also as a patient or a caregiver, just to also respect and recognize your physician's area of expertise. You know, you have to realize and be willing to be flexible as a caregiver and patient to reach outside for ancillary care. I mean, you know, if you're seeing an oncologist, their area of expertise is in that area, and if there's some other issue that's arising, certainly approach the physician, but also be willing to expand your own care team, you know, to reach to a nutritionalist or a dietitian, for example, and, you know, be willing to and able to work with multiple different disciplinaries. That's something that's important too, I believe.
Any other thoughts about this? Sherry, anything from your perspective as the parent of a
Well, I
patient?
think, you know, the primary care doctor is also a really important part of your team. And we have, since Sean was very young when he was first diagnosed, he was going off to college, he had to find a new doctor. We went through a couple of doctors that weren't curious, didn't, like, kind of blew him off. I don't know what's wrong with you. Why are you still here? And he was still there because he was still having problems. And so we went through a number of doctors. One of them, I actually remember sitting there with him, and the doctor sitting at his computer, turned around, asked a question, and typed into his computer, and answered his own question at one point. Says, "Oh, so you don't have any night sweats, right?" Click, click, click. And Sean's like, "Well, yeah, actually, I do have night sweats." I have no idea if that doctor actually wrote that down or not. I think he was already on to the next question. So there are certain doctors that you're like, okay, this is not the right primary care person for me. So I think that you do sort of have to find somebody that's going to look at you, going to talk to you, going to listen to you, and I think that's, you know, it's important for all your doctors, but really for the primary care person who's trying to, like, meet out what's happening next. So.
So in terms of living day to day with a NET diagnosis, either personally or in your family, what strategies do you use, or what good habits do you find help you manage better and help you be as productive and as active as you want to be with a neuroendocrine tumor? Who'd like to start?
In my case, many people that are on sandostatin for several years will go into diabetes. I haven't hit that point yet, even though I'm on a high dosage of sandostatin, but I am pre-diabetic. So I'm trying to watch my sugars, and I keep up with a regular exercise regimen, which I'm able to follow through on at the Wellness House.
I'm afraid one of Sean's ways of dealing with his diarrhea is that when we're going to go somewhere, he won't eat until we get there. And if that's late in the day, then he won't have a dinner. He won't have anything until dinner. And I'm not pleased with that, but I get that he has to do it that way.
I keep very active. I run 3 days a week. I work out on the other days. I'm one of the lucky ones. I was stage 4, and then after surgery, I'm NED, which means no evidence of disease. So I'm going to take advantage of that and do the best I can.
With my mom, since she's had it for so many years, her approach to kind of keeping healthy and living has changed through the years. And obviously, that's another big thing, is to be flexible and recognize bumps in the roads and when you may need to adjust either your nutrition or your lifestyle, activeness, etc. One of the things I have noticed lately of great importance as she's progressed through her disease is to push to ask for like electrolyte panels and things like that to be done. Because sometimes some of these symptoms you feel are just simply because you're deficient in B12, which does happen often on somatostatin. That's a simple thing to fix and no reason to walk around feeling bad because you're deficient in a vitamin. So that's something later here in her journey we've incorporated into her, trying to feel better and living with her disease. And that's just the thing, is to live with it, to still, feel good. And that's just one thing we've incorporated. But through the years, it's changed on how she's keeping active.
And I would say I also was very proactive at one point because I wasn't feeling well and asked for some nutritional evaluation. And I, as well, have deficiencies. So that's one thing that I do is I make sure that I monitor that fairly regularly and adjust and make sure that my levels are up. And my group is used to me saying, I think that our responsibility as a patient is to keep ourselves as well as possible, emotionally, physically, nutritionally, so that we can live as much of our lives as normal or live our best lives with this disease. And it's not just the medical treatments that go into that. It's attitude, it's keeping care of yourself, and it's easy to say and it's hard to do because fatigue is a very real part of this disease. But I will say, and it's true probably in the general population, the more you move, the better you feel. And so move, take care of yourself, but also work to keep yourself calm. And there you might look into new ways, things that you didn't think about before. But I've had, there are times when there's progression or there's things going on that are very difficult to deal with. And it involve your caregivers, involve your support team in trying to keep you up and aware and taking care of yourself. And whatever gives you calm and peace, pursue that, whether it's yoga or your church or meditation or whatever. I mean, it's also a time to try to incorporate those things into your life and just to kind of feed your spirit and keep you going through the tough times.
So how do you feed your spirit? Mary, thank you for bringing that up. What about our other panelists?
I think going to the wellness house helps me because they have an exercise program there, and it's just not focusing on the body, but it's on mind, soul. It's a whole health aspect.
Yeah, and recognizing you're not alone is a big thing in this
Absolutely.
disease, right? And that's a lot of what the support group does too. I feel that, a lot of it is just you're not alone.
In my son's case, he's an incredible musician, and he writes music and plays, and that feeds his soul, and listening to it feeds mine.
That's great.
And mine.
It's easy to let carcinoid be the blame for all of your aches and pains, moods, all kinds of problems that we have day to day. That's not always the case. So what I try to do is look outside of this, and between having my scans and having to go to the support group sessions, and I get involved with family, neighborhood, friends, and find outlets for yourself.
Good advice, thank you. I'm wondering if you think back on when you were diagnosed or your family member was diagnosed, what's the one thing that you wish you had known then that you know now that you can share with our other participants?
I remember when my mom was diagnosed, carcinoid wasn't, well, they called it carcinoids recently, now neuroendocrine tumor, it wasn't considered a cancer. So if you ever hear that, run. But, that was a big thing that I wish I had known then, that I know now, because it might have changed the way we initially started her treatment path. The other important thing I think is to nowadays hook up with an expert sooner than later. Wouldn't even try the journey to start it without one. And then the other big thing is just realize that you're going to invest a lot of time. Knowing this disease, because it is rare, it's a time investment in the journey too, and be willing to invest it along the way. Those are the three things I really feel have been kind of the mainstay through the journey with my mom.
I think communication is also very important. I had mentioned the Caring Bridge before, but there are other ways you can do blogs. But I'm on some blogs and I'm reading that these people feel like everybody left their sides. And it's not true. They just don't know how to communicate with you. So in setting up a Caring Bridge or another blog, you can put out there what you're thinking, what you're feeling. They can look at it at any time and respond back to it. I just noticed I had like 2,500 hits on mine, and I have only been doing this for 2 years. So you know that they're wanting to know how you're doing.
Any other thoughts? What else do you wish that you had known when you started this journey?
When I started this journey and I was given, what I thought was a very devastating diagnosis, I was just so overwhelmed. Hearing stage 4, I just thought, oh my gosh, the clock is ticking. But one thing I did learn that I didn't know then was that we can live a long time with this cancer. I have wonderful quality of life. I'm not ill. I don't feel sick. And life goes on, and I'm trying to live my best life.
All right, any other thoughts from the panelists about ways that you can live your best life with NETS?
I often say my attitude all along has been manage my cancer, live my life. And I'm involved in the community and as a support group leader, but there are actually people in my everyday life who probably don't even realize that I have cancer and what I've been through and what I do in my work in the community. Because I think, my goal is to be as well as I can be to live my life. And it's the life I had before I was diagnosed. You're still you still have your family, and that's always been my goal, and I guess that's part of my attitude too, is get the best level of education you can get, whether that's through any of the means that we talked about or although there's some internet ones I would stay away from. I'd say stick to the national foundations and you're good to go. But get as educated as you can, get the best medical care you can, keep asking questions and pursuing answers if they're not immediately available, and manage things so that you can go out and live your life and be a husband, wife, daughter, son, and recapture that.
I think in my son's case, one of the things that he does very, very well is no matter how badly he feels, he's always looking out for how other people are. There was one time he was in a hospital room and our cantor came to visit, and she walked in and he asked about her children, and she looked at me later and she said, you have to be aware that no matter what you're going through, other people are out there going through things as well, and he does that phenomenally, I think.
I think if you do something for others too,
Yeah.
it gets you thinking about someone else besides yourself. I volunteer for an organization called Phil's Friends, and we make care packages for cancer patients. And some of the cancer patients actually come in then after they've received a box, and then they want to help out too, because they know how it made them feel to get a box.
I think those are great thoughts to end on. I want to applaud our panel.